HUMI. The Harris-Kroner uterine manipulator injector, also called HUMI, is a disposable plastic curved uterine manipulator. The curved shape enables easy insertion into the uterine cavity in addition to the rigid handle, which provides adequate strength to manipulate the uterus. An additional catheter is used to introduce contrast media or dye for diagnostic procedures. V-Care. The V-Care is a uterine manipulator and elevator. The V-Care design consists of a double cup system and a handle with a locking screw mechanism to stabilize both cups in place. An inflatable balloon is present at the tip of the device. There are 3 cup sizes available to accommodate different cervical diameters. The double cup system includes a forward cup, which is placed on the cervix, and a back cup, which is closely aligned to the forward cup. The screw mechanism provides stability to both cups once the uterine tip is in position. The forward cup delineates the cervix prior to colpotomy, displacing the cervix away from the ureters and additionally retracting the bladder. The back cup provides occlusion of the vagina and preserves pneumoperitoneum during colpotomy incision. A 10 cc inflatable balloon at the distal end is used to stabilize the manipulator inside the uterine cavity and reduces uterine perforation. The V-Care DX is another type of manipulator, which does not include a cervical cup and is used to manipulate and elevate the uterus in procedures not involving hysterectomy, such as myomectomy and adnexal surgery. Rumi Co-Colpotomizer System. The Rumi System uterine manipulator is another type of uterine manipulator that has a reusable metal and plastic handle and a disposable sterile silicone tip with balloon. The handle is L-shaped with an 8-inch shaft and 4-inch grip. The handle with the attached tip rotates 140 degrees, 90 degrees anteversion, and 50 degrees retroversion. The silicone tips are soft and bendable, which reduces the risk of uterine perforation during insertion and manipulation. The intrauterine balloon is inflated with saline, providing uterine maneuverability during surgery. Co-colpotomizer system, which consists of co-cup delineator and colpo-pneumo-occluder, is used in combination with the Rumi system. Co-cups are available in 3 different cup sizes: 3, 3.5, and 4 centimeters. They are made from 2 different materials: stainless steel and ultim, which is a polyetheramide resin. The colpo-pneumo-occluder serves to preserve pneumoperitoneum during colpotomy and vaginal cuff closure. Placement of the Rumi manipulator starts with sounding the uterus. The uterine tip is attached to the Rumi handle, followed by placement of the pneumo-occluder over the base of the uterine tip. An appropriate size cervical cup is placed. Once the Rumi Co-Colpotomizer system is assembled, it is then gently inserted into the patient's uterus. The Rumi Arch Co-Colpotomizer system consists of the reusable Rumi Arch system and the Co-Colpotomizer. The Rumi Arch system fits all 6 uterine tips currently available in the market. The radial design of the longer metal shaft allows for easy insertion and better uterine elevation, especially in obese patients and large uteri. The Rumi Arch Co-Colpotomizer system consists of the same Co-Colpotomizer system used in the Rumi Co system and has the same 3 cervical cup sizes. The Rumi Arch also provides uterine anteversion and retroversion manually or with the uterine positioning system, or UPS. Rumi 2 coefficient system is a modified Rumi system with a disposable coefficient device attachment. The new system has a longer metal shaft, single-use coefficient colpotomy device, an additional cervical cup measuring 2.5 centimeters as part of the coefficient system. A cervical sizer is also available to assess proper size coefficient device. 2 additional uterine tip sizes are available with the introduction of the Rumi 2, namely 6.7 millimeters by 12 centimeters and 5.1 millimeters by 3.75 centimeters. The coefficient system combines the co-cup and the colpo-pneumo-occluder balloon. There are 4 cervical cup sizes available. The cups are made of the same material as the Co-Colpotomizer system. Once the proper size coefficient is loaded onto the Rumi handle, the uterine tip is advanced into the uterine cavity. The Rumi 2 Arch coefficient system, otherwise known as the avicula arch, consists of modified Rumi 2 arch and the coefficient component. The system has similar benefits to the Roomy 2 coefficient system. The new design allows for easier loading of the coefficient system and insertion in difficult patient anatomy. Once the uterine tip is positioned on the Roomy 2 or avicula arch, the coefficient device is placed over the Roomy arch. Next, the coefficient system is advanced forward until the tip is in the uterus and the cup locks in place around the cervix. The uterine balloon is inflated with normal saline. Uterine positioning system. The uterine positioning system, UPS, is designed to securely attach and position different uterine manipulators, the Roomy, Roomy arch, Roomy 2, and Roomy 2 arch. Each uterine manipulator has its own labeled reusable adapter which connects to the uterine positioning system. The uterine positioning system can be mounted to different operating tables. It has an adjustable arm that provides broad uterine maneuverability and eliminates assistant fatigue by providing static uterine pressure. This offers great margin of safety in laparoscopic procedures. The uterine manipulator system is first inserted into the uterine cavity, followed by attachment of the manipulator to the uterine positioning system. Control of the uterine positioning system is through a foot pedal, which can be placed in close proximity either next to the assistant or the surgeon console.